My name is Douglas Aaron French. I do go by Aaron. I'm a registered nurse. I've been a nurse for 21 years. I attended college initially and got my diploma from Brockton Hospital School of Nursing, and then several years later went back for my bachelor's degree in nursing at Curry College. And then most recently, I completed my MSN at Norwich University in 2011 with a focus in healthcare systems and administration. Um, I love being a nurse, and I always thought that I would eventually go on to get my nurse practitioner education and subsequent license, and didn't think it would be this late in my life, but there's no better time than the present, I guess. So I do look forward to the FNP program, my family nurse practitioner. I like the idea of that because it cares for cradle to grave, gives me a wide variety of people that I can actually work with and take care of. So I look forward to that. Currently, I work for a hospital system here in Vermont that's an affiliate of the only tertiary academic medical center in the state of Vermont. I work at a university in their infirmary and health services, taking care of about 3,000 students, and find it quite rewarding. It's interesting to care for young adults, first time out on their own, and to see their resilience, or if they lack resilience, working with them to help them build resilience, whether it be physiological or psychological. You have lots of laughs and lots of serious moments, but it's a great population to care for. You can help guide them, at least through their academic years, and help them become more resilient. So I really enjoy that role. So my working experience started 21 years ago as a RN with a diploma. I started working in medical surgical nursing for a number of years, and that slowly progressed to other specialty areas such as oncology, ICU, PACU, and ER nursing, all of which has been hugely helpful in my knowledge and clinical base. However, I did move on to management and administrative roles, and have actually also had gubernatorial appointed roles here in the state of Vermont in the healthcare programs with Medicaid. So I've had a wide variety of nonprofit work, administrative nonprofit work, and also public health and government work, which has also been very rewarding and useful in my career. My hobbies. I love music to listen to. I also play a little bit of piano, but I love listening to music. It's therapeutic for me. It kind of helps me center and dance while I'm cooking, I guess. It's a kind of a relaxing thing for me. I also have 3 dogs. I have a Newfoundland, Saint Bernard, and a Golden Retriever, who are my babies, and have always had dogs, and they're always the babies and get treated like they were children. I've been married for 30 years, and my spouse works on the campus of the same university that I work at. Something about my family. I come from a pretty big family. I come from, there's 6 kids, 4 boys and 2 girls, and most of my siblings live in Vermont or in New York, and so they're nearby. My mother is still alive and with us, thank goodness, and she's very important in my role in her life now. Is interesting how parents take care of you for so many years, and now you take care of parents, and no regrets. I actually am grateful that I'm able to do it. So she only lives about 20 miles from me, so I see her quite frequently. One thing people don't know about me. I don't know, I'm pretty much an open book with those who are closest with me. I am very passionate about human rights and social justice. My spouse and I are very active within the state and our community of expressing that. Fortunately, we live in a state that is lots of people would call it very hippie, but it's a very liberal state and a very progressive state in terms of politics and social justice. So we're in the right place, and it's something we're very passionate about. As I already said, my nursing focus for Regis is family nurse practitioner. My career goals, definitely to work in primary care. That's an area that interests me. There's a huge shortage here in Vermont of primary care physicians, but also of mid-level providers, nurse practitioners, and physician assistants. However, I would eventually like to work with marginalized populations. There are certain populations that I feel very passionate about that are underserved and that could benefit from folks or professionals that are passionate about helping them in their plight. My instructor question, I do have an instructor question for, sorry, Dr. Should know your name, Dr. Joseph, I believe. So in your practice, how have you incorporated complementary therapies, and how have your patients received that advice or that guidance? I personally have used acupuncture for many, many years, 25 plus years, when I was diagnosed pretty young with a autoimmune disorder, and was quite painful in my 20s and my 30s. And so I got into acupuncture, and I still have acupuncture done on me, and it is amazing. It's just absolutely amazing. And I share that with my patients, when they're looking for alternative therapies because they don't want to take medications, or they want to try something that is less potentially harmful. So I'm looking forward to taking this course with all of you and Dr. Joseph, and look forward to communicating with you all. Good luck, and we're going to do great.